New restrictions now in effect in both Ontario and Quebec as health officials in both those provinces try to bring the surging number of cases under control. Let's go to Ottawa right now. The CBC's David Thurton following the story for us today. So let's begin here with Quebec, David, because that is the latest province to report new numbers today. What are we hearing from Quebec regarding COVID-19?
Yeah, well, they released their numbers this morning, and this today, and the numbers are still quite concerning, a bit less than what we've seen over yesterday, but they are still over the 1,000 mark, certainly those numbers are quite concerning. So let's look at those numbers. There are 1,097 new cases, like I said, a bit down from yesterday, but not by much. There are 444 people in hospital, 73 in intensive care, and 3 new deaths. So, those numbers continue to be quite high. This is why the province continues to call on people, Quebecers, to remain home over the next couple of weeks and certainly over the Thanksgiving weekend. They're saying that you need to have celebrations within your household. So only celebrating Thanksgiving with people that you share the same roof with. They're also saying that restaurants and other indoor gathering places will be closed, particularly within those red zone areas. So those are communities from Montreal to Quebec City along the St. Lawrence River. They are in that red zone, that hot zone where COVID infections are starting to flare up. And also checkpoints, Michael, are in place, making sure that people who live in those zones are not traveling to places where there are less infections, bringing the virus, continuing to spread COVID-19, Michael.
So in Quebec, as you say, lower numbers today than what we saw yesterday, but still concerning. And that is a theme that's also being echoed in Ontario today.
Yeah, that's right. That province also released numbers today as well. Let's take a look at that. There are overall 809 new cases, a bit less than what we've seen over the couple of days, but still quite high. Toronto is seeing 358 cases. The Peel region is seeing 123 cases. Ottawa is seeing 94. There are 213 people in hospital in Ontario throughout the province and 48 in ICU. And similar to Quebec, there are restrictions in place in those regions I just mentioned. They have gone back to the stage 2 pandemic restrictions. So indoor dining at restaurants and bars have closed as of today. Also, gyms and cinemas and casinos have closed as well, Michael.
Okay, David, thank you for that update. Our David Thurton in Ottawa. New pandemic restrictions are now in effect for the hardest hit parts of Ontario and Quebec, and it comes as both provinces try to contain an alarming spike of new cases in COVID-19. Now, indoor service will be banned, has been banned at restaurants and bars in Toronto, Ottawa, and Peel region. That has been the case since midnight. Gyms and movie theaters are also shut down. Ontario bringing in the measures on Friday when the province reported a record-breaking 900 new cases of the virus. Meanwhile, Quebec has expanded its red zone designation to include nearly every community between Montreal and Quebec City. And there are also, and you're seeing them right now, police checkpoints as they have been established to discourage non-essential travel over this Thanksgiving weekend. Well, for more on the new restrictions in Ontario, we did speak earlier to CBC News medical contributor Dr. Peter Lin, and he explained how these stricter measures could help reduce demands on the healthcare system.
I know that the government is trying to keep the economy alive and not to shut down places that don't have any viruses, but unfortunately people might just drive out of Toronto. So if they want to go to a restaurant, they can go to a nearby place, maybe half an hour away, and then they can get into a restaurant. So this might actually drive people to other places. So the hope is that people will stay put so that they don't bring the virus to the smaller communities, which may not be able to handle it, and then we're just going to spread the virus that way. The second thing is that we need to figure out how can we reopen these restaurants in 4 weeks' time? Because if we don't work on that, then 4 weeks' time, our cases go down, then we start reopening up the economy, and then we go back to doing the same things. You and I take off our mask and we have lunch, and then I spread the virus to you, and then we'll have a third wave and a fourth wave and so on and so forth. So really, we need to take this time to figure out what do we do in a restaurant so that we decrease the transmission risk so that when we reopen up in 4 weeks, we're not going to go through the same cycle again. And if we look at the numbers, so let's say about 1,000 a day is what's happening in Ontario and Quebec, a little bit more than that. So let's say 1,000 a day for 5 days. So that's 5,000 patients with the virus. And let's say about 10% need the hospital, roughly. So that's 500 people within 5 days that need to go into hospital. And the problem is they're not there for like a day. It's not like, okay, you fix it and then they get to go home. They're there for a prolonged period of time, a week, 2 weeks, if we can keep them alive and keep them off ventilators and things like that. So you could see that within a couple of days, we'll overwhelm the whole system. So that means the person that needs cancer surgery can't get it. The person that needs chemotherapy that needs to go to hospital can't get it. So the hospitals will be sucked up with the COVID situation. And then you're going to hear all the same things about ventilators and everything being shortages. And that's because in the second wave, we already have a lot of virus in the community. We have people that are producing the virus locally now, whereas during the first wave, we needed people to come in on airplanes and cars coming back from other countries to bring us the virus. This time around, we have everybody that needs to produce virus is already producing it here, and as soon as we drop our mask, the virus can move across. So that's why the second wave tends to take off much faster, and the numbers become much larger quickly, and that's why the second wave does more damage. And we saw that in the Spanish flu, and we're seeing the exact same program and profile happening with this situation that we're facing right now.
And as always, we thank our medical contributor, Dr. Peter Lin.